Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Manitoba is currently experiencing an increase in COVID-19 transmission. Our data showing wastewater signals have been trending upwards. We have a slide to show that. We can see that from our data points. We're seeing that upward trend, again related to transmission of largely BA.2 variant here. We're seeing that the test positivity rates have been increasing over time. We're seeing a increase in hospitalization admissions. Most of those admissions are related to those 80 plus years of age. Over that same time frame, though, we are seeing a decrease in the more severe outcomes such as ICU and deaths. So BA.2 is currently the most prominent strain or variant in Manitoba at this point. BA.2 is found to be more contagious than the original Omicron variant, and we're seeing that in many jurisdictions in Canada and throughout the world. We haven't experienced or witnessed in those jurisdictions an increase in severity, though, to BA.2, increased transmission, but not in severity. As of our last run of sequencing, BA.2 represents about 60% of the transmission in Manitoba at this point. Looking at vaccine data, we know that vaccines are still the best way to protect ourselves and the people around us. So we have about 80% of those 12 to 17 are with 2 doses. About 88% of all adults have received 2 doses. We know in the 5 to 11 year age range, that's where we can use some work. We're seeing about 41% of 5 to 11-year-olds have received 2 doses. So again, something that parents should strongly consider. We know vaccines are the best way to protect ourselves and the people around us, and so if we could, increase the uptake in those age ranges, it's certainly going to be improving our situation here. We know that more than half of all adults in Manitoba received their 3rd dose of the vaccine. If we look at those 50 plus, that's about 70%. So we know in those at the highest risk, we are seeing fairly good uptake of that 3rd dose. But again, whatever dose of vaccine you're currently eligible for, do receive that as soon as possible. It's still the best way to protect against those severe outcomes. And we'll see some of the examples of that. So if we look from data from February 14th to March 28th of this year, after adjusting for the age differences, those who are not fully vaccinated are 7.5 times greater risk of hospitalization, almost 10 times greater risk for ICU admission, and 32 times greater risk of death. So you can see that true benefit of receiving the vaccine. If we do that same comparison, but look at the 3rd dose, it's even more dramatic. So those who are not fully vaccinated compared to those who have the 3 doses are 20 times greater risk of hospitalization, 25 times greater risk of ICU, and nearly 60 times greater risk of death. So we know vaccines work. It's made the biggest difference. It's our biggest weapon against this virus. And so we continue to strongly recommend to Manitobans, get whichever dose of vaccine you're currently eligible for as soon as you become eligible. And along those lines, yesterday we announced further eligibility criteria for that 2nd booster dose for those who are at the highest risk. So those are people living in personal care homes, those First Nations and Inuit Métis people over the age of 50, and individuals in the community otherwise over age 70. So again, this is another tool we have to boost our immunity, to protect against those severe outcomes, and we just saw depicted how beneficial these vaccinations can be. Let's present some modeling. Have a slide on the modeling. We've seen those increases in cases and transmission, wastewater. We've heard of the increases in hospitalizations, but our modeling continues to show a relative plateau in admissions. We see a bit of a downward trend there, but when we look at the numbers, we're seeing essentially a plateau in this. We can look at the next slide related to ICU admissions and see the much the same. This again is more of a plateau. It's more noticeable in ICU, where we're seeing those numbers leveling off, not seeing that dramatic decline at this point. So bringing all this information together, we want to discuss how Manitobans can use these updates for guiding their actions. We continue to post those weekly COVID update online. Manitobans can find that information, as well as trends, cases, severe outcomes, risk factors, and vaccination. In addition to that data, we know that COVID is going to continue to circulate in our communities. Right now we're seeing a period of increased transmission related to that BA.2, but COVID's going to be with us for some time, and we all know the steps that we can take to protect ourselves and the people around us. So we need to look at certainly our own risk factors, but again, for everyone, that most important step is to be up to date on the vaccine. Whichever vaccination you are currently eligible for, please do get that as soon as possible. We saw the significant benefit of being vaccinated and being up to date on those vaccinations. People who are at increased risk, those over the age of 60, those with underlying medical conditions, those who are immune compromised, need to take extra caution. And this is not unique to COVID. This is what occurs in most respiratory virus seasons. People who are at a significant risk of severe outcomes need to take extra caution. And so we know what that is. Certainly washing our hands, wearing a mask when in an indoor public place, limiting our contacts. If you or someone you care about are at increased risk of severe outcome, then we need to consider just how many contacts we're going to have in our life. Minimizing those will decrease the risk. So certainly Manitobans have information at hand with those weekly updates. We've all come to know the fundamentals, how viruses spread, what we can do to protect ourselves, and again, to reiterate, vaccination is our best way to protect ourselves at this point. And so, just like today, and at any time, if we need to address Manitobans with a change in transmission or a change in our recommendations, such as today with the vaccine, then we'll certainly be out and provide that information as soon as we can to Manitobans. Rapid tests. Again, this is another way to address the virus. We have that ability to be testing at home when we have symptoms. Again, one of those fundamentals, staying home when ill, still very important right now. And now we have the tests to aid us in that. So we've been building distribution of those through test sites and other partners, and continue to restock those supplies as needed. And so it's important to make these tests accessible wherever people are. So in mid-April, we're distributing rapid tests to participating rural libraries located across Manitoba. So far, about 50 have expressed interest, and we'll be working with them to finalize the details. We're going to be distributing rapid tests this weekend, Saturday and Sunday, from 10 to 4 at CF Polo Park and St. Vital Mall. And we'll be sharing more details on this online. And before we go to questions, I just wanted to wish Dr. Joss Reimer all the best in her new role. We saw the WRHA announce that she's going to be their new Chief Medical Officer. So Dr. Reimer and I have been colleagues for a decade. And I think she's been her work has been quite respected by all those in public health and all Manitobans, and we're quite excited for her in this new role, and certainly will be missed as a colleague in public health. But we want to wish her all the best in that. So thanks, and so let's go to some questions.
Dr. Roussin, are you concerned that with the lesser release of data, less frequent and less exhaustive release of data that the province is adopting, Are you concerned that that might affect the uptake of booster shots? Because we've seen sort of a leveling off in terms of the uptake of that of a booster shot.
Yeah, I mean, I think that's more of a function of time. I think at any time when we've had a new eligibility for a vaccine, we see rapid uptake of those who are those early adopters who really want it, and then it becomes more and more work to get that into the hands of people who are, say, less enthusiastic to receive. So there's still a lot of work is being done on that. But I think at the data right now, I think it's appropriate for where we are in the pandemic. I think we are in that transition phase, and part of that is just the amount of data and the timing of that. And like I say, we're not set with this. If the situation changes and we need to do more or adjust that, we absolutely will.
Well, why not release the data that is being gathered anyway? I mean, the public might say, well, the government has this data, so why are we pulling back on the release of the data that the government already has?
Yeah, well, we do release it, right? We're releasing it weekly, and so I think that's an appropriate level at this point. I don't think that releasing it more gives really information for people to change their behavior. Right now, if you are due for a vaccination, regardless of what data you see, you should get that vaccination as soon as you become eligible. Practicing those fundamentals, taking extra care if you're at risk, those are there regardless of whether you see the data once a week or twice a week or once a month.
How likely could a mask mandate, the reintroduction of a mask mandate, be given the increase in transmission?
So we don't have any plans on that at this point. Certainly, we've used those mask mandates in the past. We know that masks are effective. We still recommend that to Manitobans, especially if you're at high risk. But right at this point, we don't have plans on reinstituting that. But we always will be reviewing that.
From what you're seeing in the wastewater from Winnipeg, how much of the population has COVID right now?
Well, that's, the wastewater gives us a fairly good qualitative signal, tells us the direction of it's going. It's hard to relate quantitatively to that. I mean, we have some sewer prevalence data that we look at. Again, it just gives us an estimate. But we've seen, through sort of natural infection that might be as high as 60% overall in Manitoba. And as far if we look at combining sewer prevalence with both natural infection and those who have had vaccine, that's in the low 90s.
I'm just wondering, for, say, you go to an event with 1,000 people, something like that, what are the chances you might come across somebody who has an infection?
Yeah, well, I mean, it's difficult to describe that just on the makeup of it, right? We could look at things like our test positivity, which is 20%, but again, this is mostly symptomatic people, right? And so we hope at this event most people are asymptomatic, so it's going to be, you would think, less than that. So hard to quantify that. I think that the biggest thing is that you need to be up to date on your vaccine from whatever it is. If you're 70 plus now in the community, do consider getting that fourth dose as soon as you can. If you're at increased risk, then you might have to take those extra precautions and think about the risks involved with large group events.
Dr. Roussin, just to build on Steve's question back to data. In news, there's a lot of people that they really have that appetite for that information. Hospitalizations, number of people in care homes that are involved in the outbreak. If the data is there, and you're here today saying that numbers are going up, what's the downside of, or what's the rationale of just not making it a little bit more publicly available? And will that change?
Yeah, well, I mean, it can change, right, depending on what we see with it. I mean, I think that we're at that transition stage now, right? We've been at this for 2 years. We've had at points daily updates like this, and we've updated we used to update the data twice a day when we had new cases, and over time we're transitioning back into this is a virus that is going to be around for a while, and we're going to change and transition the way we're reporting on it, and if that needs to change, then it may over time. But right now we are at that transition stage. We can't keep the same response that we had through this entire 2 years. We're at that point where we can transition now.
But the impact is as severe for people that have COVID, or especially for the older people. I mean, these families and the public still would like to have a picture of that.
Well, I think that what I'd like to say to to Manitobans regarding that is that you have the information at hand to make those decisions, and that is if you're not fully vaccinated right now, up to date with that vaccination, please do so as soon as possible, and that shouldn't change regardless of whether you saw data once a week or twice a week, right? That's important. Practicing the fundamentals, staying home when you're ill. Those are all the things that we need Manitobans to do, regardless of how frequently you see the data. So, we're still sharing data with Manitobans. That might change over time, depending on what we see. But I think the focus right now is on getting as many Manitobans continuing to be up to date with their vaccine, taking those extra cautions, especially for those who are at increased risk, and we'll keep releasing the data as we are now, and may adjust over time.
Dr. Roussin, what would it take for you to bring back these daily updates? What you keep mentioning that you could bring it back. What scenarios would make you want to bring it back?
Well, I think like any intervention we do is we do that intervention if we think it's going to improve outcomes. So if there's some reason, some change in epidemiology where we think that more frequent updates will help protect Manitobans, then we'll certainly do that. But right now, like we sort of just iterated there, was that we know what we need to do. And seeing that data daily doesn't change that at all. If you're due for a vaccine today, you should get that vaccine today, regardless of whether you saw a data update today or you're going to see it next Friday.
So transmission is increasing. Hospitals seem to be plateauing. What is the longer term projection? How is this going to play out over the course of the coming weeks? Are we expecting transmission to continue to increase, and at what rate? And what's going to be the effect on our hospital system?
Well, so we see the models there, and so that's those models are good a few weeks out, and so we don't expect a dramatic change based on the models in the next couple of weeks. As far as transmission, it's very likely we're going to continue to see that BA.2 transmit in an upward trajectory here. But that's tough to model the transmission there. But as far as the severe outcomes right now, our models are not showing a significant increase anyways in the upcoming weeks.
Dr. Roussin, what about staffing in hospitals? If there's a lot of people who are being infected with COVID, it would include people working in hospitals and long-term care. Are there enough people to man COVID wards that are still full of people that need to be cared for?
So this is the other, an issue with Omicron. So that even though we see in healthy individuals, we're seeing it much less severe outcomes with Omicron, especially in those who are vaccinated, like most of our healthcare workers. It still has impact because of time loss, right, in the hospital. So it is something that's actively managed in hospital. We know they have access to increased PPE. Most are up to date on their vaccinations, but it certainly is an issue where we see increasing transmission. We'll still see some people and increasing absenteeism, but that healthcare system's been preparing for that.
One of the main reasons for all the mitigation measures we've seen over the past 2 years is to prevent the healthcare system from being overwhelmed. And you're saying that we're at a plateau now where we've got about 90 people in ICU, including non-COVID patients. Most are non-COVID patients. But our ICUs continue to be well above the pre-pandemic normal. So is there not a reason for some type of intervention so that that trends downward and not stays the same? And how long is it sustainable at 90 people in ICU?
Yeah, and so this is healthcare system has contingency plans in place to respond to increases and these levels. So the specifics of that can best be dealt with by shared health. But again, it's we see this plateau. We see the roughly about those 20 people in ICU, give or take, and fluctuation over time. But we do have, significant interventions in place, right? The biggest one is the vaccine. And again, we've just expanded the eligibility now for the second booster. So, so I think that it's all the balance. We know that many of the public health restrictions do have negative effects as well. So we do find where that balance is. But right now where we are with the severity of BA.2, with the level of vaccination we have in Manitoba right now, we think that we're at the right spot with our public health interventions.
Would we be able to get back to the level of data that we used to have? And I'm thinking specifically of things like the current number of people in hospital. Right now, that's been pulled back, and we're just getting a weekly amount of people coming into hospital with COVID. We're not getting the data we used to get about total people in hospital with COVID. And outbreaks, the data there has also been reduced. We're not getting the total number of people at any given outbreak. We're just being told there's an outbreak here a week or two ago at this long-term care home, but not the number of cases, so we don't know whether it's 2 people or 200.
Yeah, and so right now this is all, again, part of that transition to more of some people might describe it as that endemic reporting, data reporting on there. So these are all things that we follow carefully. As far as the numbers of outbreaks in PCHs, certainly that PCH is on top of that, monitoring those outbreaks. We get the reports on how many outbreaks there are. So the actual work isn't being detracted from this, and the people who are affected by it, the families and visitors in PCHs, they're well aware of the magnitude of outbreaks. And so I think it's, again, we're in that transition period. Hospitalizations, we monitor that data closely daily. Again, some of that is skewed when you see dramatic transmission in the community. There's a lot of incidental admissions to hospital because everyone being admitted to hospital is being tested. So many of those admissions aren't even there because of COVID-19. They're there, and test positive and happen to test positive. So all things we're monitoring is if trends are changing, we're going to update Manitobans. But right now, I think that at this transition stage, one of those things we have to start dealing with is not necessarily getting that data every single day. I think the weekly, we know what we need to do now, but we can always adjust our approach if necessary.
It sounds like we're in an endemic stage. I know you use the word transitional. I don't see the difference between this transitional stage and an endemic stage. What's the difference?
Well, I mean, there's a lot of different. There isn't a clear definition, say, on where we hit a transition to endemic, right? So endemic is a very broad term, with it. So I think we're still managing this in ways that aren't necessarily just an endemic virus, right? We have constantly increasing our eligibility vaccinations. We still have strong messaging to people. So we're not managing this fully as an endemic virus at this point. It is a transitional stage.
Dr. Roussin, you said increase in cases and transmission is expected. Is what you're seeing kind of within what you expected? Is it trajectory going faster?
Well, that's it's going as what we've seen in other jurisdictions that have preceded us with BA.2. So again, there's with all of these variants, it's hard to know what to expect with them because they're all different. But from what we've seen in other jurisdictions with BA.2, once it's introduced, it's going as what we would anticipate.
Is there something unhealthy about providing daily updates when it comes to hospitalizations and more details about hospitalizations? Like, is there something from a public health perspective that's unhealthy for the public to get this information on a more regular basis?
Yeah, I don't think I would frame it that way. I mean, I think that we do have to understand that we're going to not deal with this virus the same way as we have for the last 2 years forever. And at some point we have to transition, away from that intense data reporting to less frequently dating. So I think that at some point we need to accept that. I wouldn't frame it necessarily as saying there's some direct negative health impact on it, but we do have to accept we can't continue to manage this virus in the same way we have intensely for these 2 years. The biggest thing I would say is we're not focusing on the frequency of data reporting, right? The focus should be on getting your the vaccine that you're eligible for as soon as possible, practicing those fundamentals, taking extra precautions if you're at increased risk. That's what people should be focusing on, and daily reporting of data doesn't change that. So that focus has to be on the increased eligibility now, that second booster dose. That's the message we really want to be sending here today.
The initial rollout of vaccines saw about 70% of people rushing, the keeners, as the bureaucrats call them. Now that looks to be dropping to 50%. And so again, I'm going to rephrase my first question. Do you think that pulling back the data and having less frequent updates maybe sends a signal to the public that there's less urgency to get a booster?
Well, that certainly our message is very clear, that if you're eligible for a vaccine, get that as soon as possible. So we're not sending a message other than that. And again, if you think at the sheer uptick, 88% of Manitobans with 2 doses, we would never see a vaccine campaign in the past that we could get that many Manitobans vaccinated this quickly with 2 doses. So there's a lot of success there. And now having a 3rd dose, a 4th dose, you unfortunately do expect some of that to trail off, with just the sheer length of how long we've been dealing with this virus. But certainly our message is really clear. It is get vaccinated as soon as you become eligible for a dose.
How many people are in hospital right now with COVID-19?
You know what? I don't have the specifics on that. We can get you that number.
Do you think that the message to get vaccinated would be amplified if people knew how many cases there were at different care homes and hospitals? Do you not think that that amplifies the message to go get vaccinated because it's really bad, or because there is a threat?
Well, if it does, then they have access to that, right? It's weekly. Yeah.
And it's not as specific, and there's not definite numbers.
Yeah, so I mean, like I would say is, with our public health approach, if I thought that daily reporting would do that, then we would have daily reporting or twice daily reporting if I really thought that, right? I think that Manitobans are well informed about what's required to protect themselves and the people around them, and we really want to focus not on the frequency of that data. We want to present the data, and we present some modeling here, but it just we know our best tool is getting vaccinated, and now today we've expanded that criteria, and that's really the message that we want to get out there.
Dr. Roussin, can you give a little update on what's happening with Paxlovid in Manitoba, and whether that's going to be a little bit more available to people? I know some people in Manitoba wouldn't be eligible here, but they'd be eligible in Ontario. What's the situation there?
Yeah, so we're still looking at the eligibility criteria, and we have changed that over time to get more and more doses out. So certainly Paxlovid is effective at preventing severe outcomes. One of the 2 big drawbacks from it is one is the timing, right? We have to get it into people before they pass 5 days of symptoms. So we need people to recognize their symptoms early, get tested, and then be assessed. The other thing is there's some drug interactions with it. So we do need to be on top of the individual's history. So some people are excluded based on that or kidney function. So it's not an easy process to find those eligible people, but it has been a lot of work and and we're still getting those doses out.
Do you know a little bit of roughly what the rollout has been, like what percentage of what we have and what's been rolled out?
No, I don't have a specific on that. Yeah.
Is the vaccine task force still up and running?
Yes.
And who is the new medical lead?
Well, so we have the vaccine task force. It's still running. We don't have plans on rolling that up. We might, certainly change our approach, but they've really laid the groundwork for things just moving smoothly after we expand criteria like this. All the framework is there just to have our clinical care partners to be able to expand this criteria. As far as the clinical lead like that, I don't know if we have a specific person that we've announced that. Certainly I'm playing a role on that vaccine task force, but like I say, the work of Dr. Reimer and all her team have just set the framework so smoothly for every time we make a change, the processes move quite easily.
The ICU numbers are very high, and again, most of them are not in there because of COVID, but that certainly adds to the stress on the system. Is there something else right now driving the ICU numbers?
In the adult ICU, I'm not aware of anything specific, right? I remember a lot of getting back to a lot of surgeries, so things like cardiac surgery, many neurosurgeries, they require ICU post-op, so a lot of that is relevant there. I know in children we're seeing RSV circulate to higher numbers. But as far as the adults, I'm not aware of anything specific.
Dr. Roussin, is COVID-19 playing a role in the cancellation of surgeries? Like people come in for surgery, they happen to test positive, their surgery gets canceled. Is that happening at a higher rate?
Well, so for the specifics of that, let's direct that to shared health. But I mean, it certainly occurs. You know, if you have a pre-op testing and someone tests positive, that surgery may be delayed, so it could play a role in that. But the specifics I'll direct to shared health answer.
Roussin, have you been attending large public events lately?
Yes, yeah. So I've I'm not sure any specific things, but I'm have my third dose, and I've attended. I still wear a mask in indoor public places. I still work clinically and assess people with respiratory viruses, do tests for COVID-19. So I have been attending public
Do you feel
places.
comfortable in those settings where masks are not required and a large number of people choose not to wear masks?
You know, at this point, my the way I personally assess my own risk and vaccine status, then yeah, certainly I wouldn't be attending any large events if I didn't feel comfortable. So I do, but again, that can't direct any individual. Every individual has to make that decision on their own based on their own status. Yeah.
Would you recommend asymptomatic testing before social gatherings if rapid tests were fully widely available?
So not widely. I wouldn't recommend that on a large scale. Certainly at that individual level, you're visiting someone that you feel is at increased risk, and you want to take that extra step to test yourself, even though you're asymptomatic. I think that's reasonable, but I wouldn't make this as a general advice to everyone to test yourself before you go anywhere. If you're symptomatic, absolutely stay home with or without a test.
Are pandemic matters taking up most of your time these days, or what if anything, what public health issues keeping you up at night, if any?
Yeah, so there's a lot of public health issues that are ongoing. A lot of them certainly the work didn't stop, but had to be curtailed to some degree during the pandemic with the amount of work there. But right now, I would say the sexually transmitted bloodborne infections certainly we're transitioning into much more work in that regard. We know that we have many issues with substance use and harms in Manitoba, so there's a lot of work on there. And then just getting back to the communicable diseases, vaccinations other than COVID.
All right, thank you very much, folks.